security and whatnot. But
Yeah.
I think they would be overexerting their authority when it comes to going into hospitals. That is a place where doctors and nurses and specialists should be. I don't
Yeah.
think that police have any right to handle life and death when it comes to hospitals. I
And
the firm stance I'm gonna have on that. Like if a police, I feel like the police was very irrational,
course.
and very dangerous. They became from serve protect, it became a lie.
To
At
a
that
to an
point,
uh,
offender,
because
almost to a near
if you
offender.
draw a gun at a healthcare professional, what threat does a healthcare professional provide to the police officer? None.
None,
So
because they're trying to save
at
lives.
that point, I can say that there was a lot of egoism going on there.
uh, um,
If anything, it became
and
personal.
I was gonna say hospitals usually have security there too.
But
Right.
Uh,
But in this
security let
situation,
go of like when it comes to authority between a security and a police. I'm pretty sure the
the
police
police
usually have.
officer would supersede the
Yeah,
authority of the security personnel.
yes, at least to get
yeah,
in.
I know.
So
Yeah, to
that's
get in, yeah.
yeah, that's the only thing. But inside the
But
workplace in
inside the
general,
workplace itself, where there's people dying and sick,
and knowing that you're
I don't think that police should have authority in that say.
exactly
If uh, if these guys are young or like
it.
don't fully comprehend the Constitution or the rights and things like
It does
that, I can see this
no.
because this is what it sounds like that they just
Wait, were they
since they
trying to
have a
arrest him or just try to take him into custody?
They were trying to pull an unconscious suspect and throw him into police custody and transport him into, police custody, like where the police station is. The nurse
yeah
preventing the police officer from doing that because by law it is illegal for them to discharge an unconscious patient.
Exactly.
Yeah, I would be surprised if, regardless of whatever district you're in, that the police have the authority to take into custody unconscious patients from a hospital.
Yeah,
Yeah.
in this case, a police officer was trying to do that, which is
Yeah,
why I'm saying I
don't
think
believe they have that power.
yeah, I think they have an
Yeah.
overexertion of their own power, which I don't think they should have any right to. I
Mm.
think I think there should be new laws established regulating that, where if police step into hospitals,
They have to abide by
they have
the
to be
healthcare.
given permission
Yeah.
by either a director, the head of security, or even head nurses to to even enter the hospital and to question patients or to discharge patients. I think that should be all under the control of
I feel like
nurses
that's
and
like the
doctors.
top head. Yeah, usually the
I do
director
feel
or
as
the one
though
in
that's
charge of the hospital.
already a law and that these officers were in violation of it.
Of
That's
course,
yeah
not
yeah
100%.
made my
If any,
Go
I
ahead.
mean, I'll have to look it up, but I feel like that's already a thing.
Let me ask Trinity that. Was that already
Just look it up.
For doctors to take over?
you didn't hear?
Well, I was hearing when doctors were like taking over.
So in this case, well, with my example, basically, like, should nurses and doctors have the authority over the police when it comes to discharging?
Now I know what
patients?
I was like thinking about it. I was like, we already do actually. Like, I
Okay,
don't
so
know.
that solves
Like,
that question.
I'm used
yeah,
because I've seen like literally like let's say there was a patient that came in, they weren't even talking at all. So what the police did was they have someone on standby constantly. And I remember even asking, it's
yeah.
like, why are you here all the time? Usually you guys leave because you know this patient is considered not medically cleared to leave the hospital. And they're like, that's not I'm not allowed to tell you. And then to hear later on, like I think they were being charged for murder. So and then something happened to the patient, so they're stuck in the hospital for a while. So they didn't want to leave. So I'm like, the fact that this whole case started like this whoever the police officer was who let me just take this unconscious person. It's like, why are you making your life so difficult? Just have someone on standby here and go off your merry way and deal with the other people outside here. There's worse people outside than here. You just
Yeah,
get your own way.
yeah. You could
So the fact that that case happened is just odd to me, but I wouldn't be surprised because there's always some sort of police officer that has that, like you all said, you have your ego like way over the top of your head at this point.
Or it became personal.
It sounds like the police officers just didn't like. Again, they didn't know the rights, they didn't know the laws, they didn't know
I'm pretty sure they knew the
I'm
rights.
pretty
Constitution.
sure they should if they're a
They-
full-fledged
they-
police
How
officer.
to be an officer
Yeah,
without knowing
they
your Miranda
should.
rights?
Yeah, but
It,
like depending on how old they are,
it doesn't matter.
No, it's
to
not even
all
that.
of us.
It's probably the case where they were just told that they were just given their orders and they're just gonna follow their orders.
I could.
I don't think
That-
I
I
don't,
wouldn't be surprised.
No,
though.
I don't think so. Because when you're a police officer, you go through certain things. You go through classes and everything. I'm pretty sure one of them is to be like. I'm pretty sure to not overstep your boundaries or certain things. I'm pretty sure.
I mean, you would
Yeah,
say
but
that,
they're
but
not
it's
right.
not
all of them listen to that stuff in class.
Well, that's on them then.
No, because you would say that, but if an order comes down from up top and it goes against the regulation, then you have to choose between following orders and keeping your job or doing the right thing.
Well, that should get whoever's the higher that asks you for it or to question the one that does that right away because they should not have any.
No, I
No,
feel like
Brendan is absolutely correct about that because
Really?
it is absolute that police officers follow orders to the T, especially when
Oh,
from the higher up.
True, I understand that, but
I-
in my question, though, like you should, but that should not impede on overstep your boundaries at a hospital, though. Even still.
Yeah, which is why it goes into what I was saying earlier. Shouldn't there be new laws regulating that?
Oh yeah, we
making
don't
it
have actual
clear-
laws. I'm assuming,
Yeah,
right? for that?
differentiating the authority between healthcare and police security. Because in
Okay.
that instance, we definitely can say we all can agree that the police definitely overstep their bounds.
Of course.
Okay, like my point is that when you're a greenhorn or when you're a quote unquote vet, depending on how old you are,
Say greenhorn instead of rookie.
were yes, greenhorns are rookies, yes.
Why'd you say that
Uh,
instead of rookie?
Well, because it's just shut up. Okay. So so
Oh
so
Lord.
when you're a rookie or when you're let's say a veteran or some stuff, these things there's rules and regulations that obviously change throughout the years, and same thing with how these people are taught the law. So let's say someone who's in their 40s or 50s who's been on the police force for however long, they're already set in their ways. While someone who's in their 20s who's on the police force thinks that they know what they're doing, but they feel powerful in the uniform. They feel like they have a good amount of knowledge of the law and the Constitution when in all reality
It's
they really
really, they
don't.
should cost.
So it's like I feel like it's the mixed bag when it comes to the ages, but in all reality, both forms of cops may not really know the Constitution or the laws of the certain state that they are in, which could have led to this. Now, if it was a order from high up and they still just wanted to do the thing like that just falls all of it in all scenarios falls upon the department.
Okay, so do you still think that police and healthcare professionals should be on even playing ground then?
I never said that they should be on an even playing ground. I said I feel like they should. No, I
Oh,
did
I
not. I
could have
said
sworn you did. I thought you said they should be equal.
Yeah,
no, I said that they should be able to work
Yeah, like-
together.
They all need to get like how nurses have to take like the same continuing education stuff. Probably police officers have to go through the same type of thing where you need to do the same continuing education stuff for police. So you kind of have these refreshers of, hey, you need to follow these, and you need to sign off that if you don't remember this, that's on you, and it will be on you later. So
Yeah, like I didn't say that they should be like they can be equal to a certain extent, but they should like when it comes to one superseding the other, obviously people taking care of someone is always going to supersede the other. But if it comes out like someone in the streets or something, I feel like they should more be able to work together than worried about who supersedes who.
I mean,
I just want
yeah, go ahead. Go ahead.
no, there's one first thing clear. We don't actually have a law in regards to that in this situation, right? When and it comes to hospitals that the higher the healthcare professional has authority over the police in this situation, right, or anybody else. Do we have an actual law for that? That's one.
I'm not agreeing with this viewer, but I just saw ACAB.
Excuse me.
all cops.
I can say for a fact that all cops are not bad. There is a I will say that there are videos of showing that cops can overstep their boundaries with people on the roadways, people trespassing, people doing misdemeanor like things, and they definitely do overstep their boundaries. But
Okay,
that
so
I
yeah,
feel is
answer the question.
Not
Police.
all cops, just not all cops are all bad.
Oh,
Okay.
to
I
answer the
was
question, police do not have access to patients. Typically, no,
They should not.
so
they do not.
They do
No,
not.
no, it's
so
what it's
I'm
what
just
you were
asking.
saying
That's why I'm
earlier.
asking. That's why I'm
Yeah.
asking if there's a law for it specifically.
Yeah, that is a law. Yeah, they do not
Okay,
have access.
okay. Then,
They can request.
literally, then what that cop did in that video, well, obviously he broke the law right there.
okay, there you go.
There we go.
But
Okay.
to answer the viewer, I have had two run-ins with cops, actually maybe more than a few run-ins with cops, and they were all very nice, down to earth people, and they all came from very understanding places, and yeah, they weren't what I feel the minority of bad or corrupt cops that a lot of the videos show of like, oh, get oh, what's this, oh, it's a walking cane, oh, well, I'm sorry, I mistook that for a gun, thing like things that the audits show a lot of cops not doing a really good job, and mostly because a legally blind man wasn't using his walking stick, they mistook it for a gun, and because he was giving an attitude to the officer because he wanted to take it up in court about his
Despite
walking
him
stick
coming
not
from
being
court,
a gun. Say what?
despite him coming from court, he was on jury duty, I believe. I
Yeah,
know which guy you're talking about. I watched the video.
and they said, "Oh, that's fine. We're just going to take him in for resisting." He was not resisting at all. He was just walking from jury duty, and then they canceled jury duty. So it's like, what you want from the guy, you know? But yeah,
Uh, um, Loki says one cop tried to full on arrest me for walking to the gas station around midnight. Why did they?
Um, is there is there a curfew during those times for where you live, Loki? That's the only thing I could think of, really.
Yeah, it could be a curfew thing.
Yeah,
Yeah,
that's the
or
only thing I can give it to them. Not on
So
the
Or
there's
they
no
could have,
curfew, there's no curfew on the weekend.
or they could have
Okay.
thought you were being suspicious because it was like near midnight and things like that. There's always like
It was on the
profiling
weekend
kind
when
of
it's not
stuff.
Mm. They shouldn't really. That's the one thing about with cops when they assume things.
Oh,
I
but see,
I
that's the
hate
thing, though.
that.
They do that all the time, and
Yeah.
even though it's annoying, I have to say,
It is their job.
it is their job. They have to.
Yeah, yeah.
He thought, okay, he thought you were getting drugs.
Yeah, that's their thing. That's why that's going
No,
back to
but yeah,
But
that's honestly
but
that's
like,
yeah.
they
At
have to
least
do it.
they have to do that. As long as they're not doing
yeah,
anything that
Probable
literally
cause.
goes,
Yeah,
yeah,
it's
probable cause, or
okay.
yeah, literally, or
yeah.
not doing anything to
He
restrain you
searched
like
you.
that.
He searched you just because he thought you were acting suspicious. That was just it.
Yeah, like
It
unfortunately, it's what they have to do that. Like,
yeah.
it's like in the spick of midnight, like that. Like walking through midnight. It's really it's like I'll say my own anecdote here. I had experience like that before. I was walking on the sidewalk and I ended up in a park at like 1 a.m. in the morning, and I was just chilling on the bench. Like I was depressed about something, so I just wanted to walk and keep my mind off things. But woo, light, and then police officer was like, "Are you okay?" And I was like, "Yeah, I'm just chilling here, smoking a cigarette."
Oh, yeah, they should not be doing that, really.
No, no, no,
Okay,
no. But
so I have a
No, no,
question.
no, 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 no. It's what Loki put afterwards. Is it okay? But pinning me on the
it's what
car,
Loki said. Okay.
that is not. Yeah, should not happen. That is where you. They
That's
should,
unreasonable search.
exactly. No, they
They
can
didn't.
ask
They
you.
didn't actually have a probable cause for that.
Yeah,
Because you already answered their question and you didn't want to be. You didn't want to be there. So for them to throw you onto the car like that, pinning you in the car, they have no
they, sh-
reason to do that.
they should not be touching you like that. No,
That's already like overstepping their bounds at that point because
of course. Yeah,
they
they
don't
can
have any
question you.
reasonable suspicion that
Mhm.
you are in suspect of trying to attack them or you have a weapon of any sort. They can assume you have a weapon. They can't just, hey, I'm gonna fuck you up because we think you have a weapon, right? That would be equivalent to saying, hey, I want to punch this black guy because he could be a thug or probably from the Crips and the Bloods. No, that's also racist, but like that they need to have a reasonable, you know, they need to have a reasonable probable cause to even do that. So the
Yeah,
fact that they did
assuming
that
to
to
not.
you, so the
Yeah,
fact that they did that to you, you can file a complaint.
of course.
If they did more than just pin you to a car
Oh, that's very
and
bad.
they
That's
start
beyond.
punching you and they did damage to you, that's when you can bring that to court.
Of course,
Because
get that.
that's where it takes it a step too far. Now, can I
Yeah.
agree that like, I can agree here that can cops be annoying when they do this stuff? Absolutely. But are they simply doing their job? Yeah.
Yeah.
Now, if they aggressively attack you in that kind of way, then they're going out of their bounds right there. So it shouldn't be in their right to do that to you at all.
Yeah,
Yeah, yeah, of
trust
course.
me. Me and my dad, when we were going to get my cousin one time, we were in Milltown, and there's this one. Uh, I guess it would be a bump that you go over, and then it goes down, and depending on how fast you're going or whatever, uh, it leads right across some train tracks, and there was a cop waiting down there. So it's like he was just doing that to meet his quota, and he gave my
Wait,
dad a ticket.
say that again?
Okay, so there was probably like a bump or whatever, and we were going up. It was an incline, and then we declined down, and there was a cop waiting down there because obviously the speed from the going down the incline was going to make the car speed up more.
Yeah, but you can still
So
control that.
Yeah, no, my dad just had like the car in neutral or something, and he was just letting it go because he wasn't expecting a
Just
cop
because
to
you're
be
on a
down.
hill doesn't mean you get to go over the speed limit.
No, no, he wasn't going over the speed limit. He was like 5. Yeah, he was like 5 over the speed limit, which
Speed
isn't
limit.
bad. But
Still over.
there was a cop just waiting down there with
There's
his little
actually
radar
hold
gun.
on. I'm gonna interject. Ren, there's actually a leeway
I know.
to over the
I
speed
know. A
limit.
leeway 5 over. Yeah, I know, but still technically over, and
I thought it
they
was 10
can
over,
still give you
or
over.
they changed that.
It's usually 10 or 15 over. You can.
I don't think it's
Yes,
15 anymore. I
but
think it's 10 over. I'm
It's
pretty sure, but not
Yeah,
15.
I've been going 30.
Wait,
Oh my
wait. I
God,
can
sorry,
resolve this
Bruno.
really fast. I can call upon a good friend of mine that is a police officer.
but the
Oh,
thing
yeah.
is,
What
right,
I think
is
it is,
that
DJ?
he was just doing it to meet a quota. You could tell.
Okay.
But
He
before we
was
go off tangent, yeah, continue your story, Gemini.
no, that's literally it. Like that
Okay.
was one of the first interactions I had with cop. It wasn't that pleasant, but it didn't make me hate cops. I just saw that he was doing what he had to do to meet a quota of freaking giving people tickets, and it's like, well, I guess you got to do what you got to do sometimes, even if it is messed up.
So are you against speed traps in general?
Hell
No,
yeah.
I'm not against speed traps in general, but I feel like a speed trap should be more of if somebody's going like down like a highway bat out of hell. This was like a very very secluded road that we weren't even going. We were going like 20 miles an hour, and the
All
guy
right.
had a speed trap. And he just decided to be like, "Whoop! Up, you were going over the speed limit." And my dad's just like, "No, no, no, we weren't."
All right. But before we go too far into the police topic, let's go to the next question. Should nurses be given more rights when working in hospitals?
What do you mean given more rights?
Yeah, what
So,
rights?
how
What
do
does that mean?
do anyone add?
Like a police officer rights?
No, that's
I
not what
don't
we're
know.
referring to.
Have limitations in the hospital of what we can or can't do.
Ah.
Thanks for that. So
So what
I
limitations are you
feel
guys
like
talking
for some
about?
things we're just really restrictive in things.
Okay.
And I think like because we kind of if I don't know if people see like other social medias regarding nursing stuff, but we have a lot of things that goes on with ourselves. It's like we're not just nurses; we're doing everything else for you, but we still get paid the same thing. So I believe for like rights as in like um
What rights are you want to tackle upon that's limited to you, if I may ask?
what rights were we going for with
I
this?
don't think the word right is correct. I
Oh
think what
well,
you're looking for is
that's more
privileges.
more just limitations.
I think what the word you're looking for is privileges.
Privileges, thank you.
What privileges?
Ask Rin that. He's the one saying it.
What privileges?
No, I don't think the word you're looking for is right. More like I think the word you're looking for is privileges.
What privilege then? 'Cause
No, instead of your
Uh,
question being phrased as should nurses have more
there's
rights,
more
I think
rights.
the question
There's
is phrased
more
should nurses
privilege.
have more privileges.
Yeah, and then I'm assuming nurses don't have any privileges in some ways.
Do you want to
Uh,
add?
Like,
Well,
like
They
for
they
example,
should
like,
get free food in the cafeteria.
like I wouldn't
Yeah,
word
because Trini's kind of confused at both ways of questioning this.
okay,
Uh,
so like for
but-
example, I
yeah.
wouldn't put it as like for example, in my warehouse, we're no longer allowed to have earbuds in, right? I wouldn't say being able to wear an earbud at work is a right. That's a privilege. Because they set the rules and they allow you to have them allowing you to have things is a is a privilege, not a right.
do it for like they make reasons why you can't do such things. Like have a water bottle on your nursing station there. Because that's absolutely not allowed. It's gonna be contaminated and blah 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 when we don't even have enough time to run to a break room. So I guess I don't know if that's considered a privilege at this point to say, hey, let's just have that come here instead.
Like, and I know, and I understand, but typically how it goes is one person fucks it up, and now no one gets to do it because they have to protect, the business themselves have to protect themselves from their employees. Because employees will do dumb things and get sick or hurt or injured, and then it's the employer's fault.
Applies for like every job.
And then they put policies
Yeah.
involved. Yep.
Yeah.
That's really how it happens. Someone does that, and things happen afterwards.
Like specifically with the earbuds at my warehouse, someone got hit, got injured, while having an earbud in their ear. Now no one's allowed to have them.
Yep.
Well, that guy's a fucking dumbass then.
Okay, so let's rephrase the question in that regard. Should we have? Should nurses be given more privileges when working in hospitals?
Yes.
Why
Yes,
so?
because they usually do most.
Well, I will say a generally less restrictive environment is a more productive one.
Okay, do you agree?
Keeping you less miserable while you're there is a net positive.
But at the same time, wouldn't you be too comfortable and you could be overstepping your boundaries possibly?
I mean, that's a risk, yeah. It can go either way.
Oh, I have a say for this. I think
I would
most jobs
say-
Oh my
that
God,
are
he is-
physical labor should give you a free membership to any gym of your choice.
Oh my freaking god!
Loki
Okay.
says depends on the person.
Depends on the person.
Yes, I would say yes, depending on if you give certain privileges to the nurses and one of them doesn't, as Loki says here, doesn't take advantage of it or fucks it up for the rest of the people who now have this, then you're good. Then you're golden. But if you somehow, let's say, contaminate something and then that hurts somebody or someone else, maybe a patient or something, then you're getting that thing taken away from you.
So this kind of goes.
And-
Go.
No, it doesn't just get taken away from you; it gets taken away from everybody else who earned it.
Everybody.
Yeah, because they kind of do the whole like military thing, right? Where it's like if somebody fucks it up for your whole team, everybody gets punished.
Whose donut is this?
So I have a question to this. So should just the privileges in general, just not specifically going to nurses, but should the privileges in hospitals depend on your classification, as in your title of work?
Wait, what was the question?
Should privileges be different depending on your title of work in the hospital?
In some regards, I think so.
Well, like I don't know for privileges, but for doctors and such, they have certain like doctors versus nurses versus like assistants or techs or even housekeeping. They all have restrictions of what they can or cannot do.
Yeah.
Mm-hmm.
So that's why I don't know if it's like a privilege to have like other things, but you can't do some things. Like I can't prescribe you any medications.
Of course.
Like I was thinking more along the lines of like the surgeons get a surgeon only break room, which is close to the ER.
See, I
But
can
what if-
see that.
Oh,
though.
okay,
I was
so
thinking
I actually have a
along that
question.
lines. Yeah.
What if there's that? Well, I don't know. Like, what if they possibly have? There's like a certification for if they were able to. No, that should not even be the case because that's what
That means you just have the ability to. You're like
Yeah, you're pretty much. Yeah.
See, like I feel like with Rin's example, like the surgeons having like a kind of room for them to where like they're close to the ER. That I
And
feel like
like
that
say
that
like
would make
doctors
sense.
aren't allowed to use it because you don't like the idea is to keep it, the free up space for the surgeons.
Yeah. I feel like that in a way it's fine. And also like nurses should have their own kind of place too, and like just keep
I
everybody
would
with
say
their own
nurses
kind
should
of
have more designated break areas.
yeah, that's definitely a good one. Or
Well,
maybe more time on their breaks.
do. It's just most like in every pretty much in other states, they don't really have a break time. Your break time is in front of a computer documenting your patient care.
No, I
Yep.
know. Like, I mean, like, okay. So when I say more designated break areas, I mean more like the facilities, like for example, water coolers in more areas that makes it so that you don't have to go too far to reach places.
Cooler is the patient cooler. Water.
I
I got it. I'm gonna drink from the same water you're drinking from too.
I would say more break time because like let's say you and a certain pair of nurses have to care for one patient. That's fine. But just like if you have more break time than said certain nurses that you're working with, that should be fine. And then after that, you can exchange that time with the nurses that you're working with. That can work.
So like legal, like universal or legal break times.
Yeah,
Because
it
that
could
doesn't
definitely
happen.
work.
That doesn't happen at all hospitals. I can definitely say that.
That's kind of like really hard
Oh,
for I
Howard,
think in majority of the places, because I feel like when it comes to like I think with people's and just jobs in general, I feel like they have a set break for everyone. Essentially, they should, so that nobody goes over or they just use whatever time they can equally. No one's be above anybody else. They shouldn't. So
okay,
if
thanks for there.
if the
Yeah,
job
so
allows a half an hour, they allow half an hour. They allow an hour, they allow an hour.
yeah, but that's usually the people who like at the top who's like paying you though.
That's it, well, they're the ones paying you, so they kind of set the rules on that one.
Okay, what if I met my boss,
Hmm.
And then you kicked
told
him in the
him
nuts.
I told him I will give you a free blowy every
Oh,
time
yeah.
Okay, let's not go there, please,
Yeah.
Gemini. Please not.
every time
That's
you give
only
me a
if your
break.
boss if that's only if the boss says yes, fine, you can do it. But that should not be at a consistent every time though, because that's not fair that he's giving you more than someone else would. That
I
has your
think it's
position.
unfair that he has to give a blowy every time he wants something.
Well, that's
That's
what
the
he has to do. That's what he has to do to get it. That's inclusion with your boss. That's up to you. But in actuality, let's think about it truly. That everyone should have a set time based on what your workplace provides, because that's what your workplace provides. But
Nah,
in
I'll
the
do
but
anything to get ahead, man.
oh my fucking god, even for a break, Jesus Christ. But in regards to to the medical field, it's like Trini said, it's you find your break whenever you can, because hospitals nonstop pretty much. It's always a situation happening, no matter
Not
what.
for me.
I don't know what kind of hospitals you've been through, but that's but I don't know, but yeah, that's literally the case. So the amount of days you have off, that's a whole different story, because that's perks with your job titles.
All right,
I'll
let's
use all my days off the first time.
Well,
Yeah, first term, and then just
well, that's on you
work
by that
every
moment.
day after that.
Well, that's on
right,
you. That's how you use your days.
let's start with the next question.
Oh, good lord.
I think we briefly talked about it,
I think
but
we did.
Should we have a free healthcare system?
I think
Option.
we
Mm.
do
Could
already.
we have?
in a
It would be.
sense.
I would say it would be optimal if we did, but not if it wouldn't.
But it's not. It's not. It's borderline near useless, though. That's the thing.
Well, that's
Considering
the
how much
thing.
we
Like,
can.
yeah.
It,
I mean,
it,
like,
if like I guess financially it's okay. It's good. Obviously, it's free. But whatever it provides is not very like. It's borderline near bad. It's
But
gonna be very minimal.
would there be negatives if America converted to a free healthcare system?
Yes.
Well,
well, if
wait,
America did it like today, absolutely yes.
wait. What was the question?
If wouldn't there be a lot of negatives if America suddenly converted to a free healthcare system?
Oh, without a doubt, 100%, yes.
It doesn't even have to be today, but just suddenly
It,
converted to a
it,
free healthcare system. Yeah.
do you? So there's certain. I think there is like that's really gonna be bad in a way
So
because people will be overly reliant on it, and
I
We
mean,
don't
we
have enough
kind of.
hospitals for this because a lot of them closed down.
yeah.
So
It, oh, you go ahead.
so the thing, right, is that we kind of do have free healthcare clinics, but we don't have um free healthcare like everything else. We only have clinics that you can go to, and they will accept more so mostly any insurance that you have, even if it is bad. But you still have to make an appointment. Still, it's still Americanized to an extent. Um, it's just, even sometimes even the waiting times don't even matter. You just have to make sure that you're there at the appointment time. And I want to say sometimes the doctors there aren't even that bright,
They
but
do the bare minimal.
yeah, they do the very bare minimal. And the only reason I'm sharing this is because my primary works at one of those clinics, which is not, in my experience, not good. Now, if we were to do a free healthcare for hospitals and everything, urgent care, ER, things like that, a lot of it would be backed up. I feel
Yeah,
a
no,
lot of it would be
no,
backed
no,
up.
not a lot. It is gonna be backed up because the people that overly relying on it because it's free, like the amount of for the time, the funding behind it, essentially it's gonna be non profitable, like profit pretty much for those kind of things to happen, and it not being that's where like money kicks in to funding those kind of things to happen. They will not. It's almost kind of near it is voluntary essentially work.
Yeah, we would end up like
Uh,
Canada.
True. But that's what I'm saying. It's not going to be good. It's going to be chaos and it's going to be backed up, and people it may not even go through all of it because one area if all of us were to have there was who like none of us are gonna like none of the people are gonna be working through that because why would you do the work for free essentially if you're not going to be paid for it for doing something and
Yeah,
they reap the benefits for it for being free.
And like what Trini just said, there was not enough hospitals to cover all.
Exactly, there you go.
yeah.
At
With
the same time,
how many people are.
It would be voluntary work.
I think there's more negatives than positives with the
Oh,
free
of course, well,
healthcare.
100%. In my opinion,
Yeah.
the only positive is helping the patient than actually the people that doing the job than anything else.
I was also gonna say with how many people that are actually in this country and going to
Yeah,
all
literally,
these
we're only increasing.
limited. Yeah,
Wait, one more
with
time.
all
One more
these.
time.
I was gonna say with all these limited hospitals that would magically be on free healthcare. Yeah, no, we would have too many.
Nobody, and not only that too,
And
in the later future.
there'll be a too much long wait time. Like if you want to be seen at a hospital because you're bleeding out, you would have to wait like 15 months.
Yeah,
Literally,
there
yes.
would be. It would be too much because of the populace that we have. So
Yeah, and not only that too. In regards to that, people that are gonna be in the medical field in the later future, if they were to happen, that has no, like, it's gonna be everything is free healthcare. It's gonna be bad because they're not making money doing this shit because they're being paid to do it. So nobody in the world in their right mind would do be in the medical field if that were to happen. So eventually it will die out.
Uh,
Goku, you can now ask your question to Trini.
Oh, okay,
We're
okay. Yeah.
We're doing a little bit of Q&A because there's actually almost not that many Q&A right now.
Okay, awesome. All right, Trini, what's the average cost of a meal in the hospital cafeteria right now? I'm just wondering.
It
That's
differs.
She's
why
asking for a friend.
I don't know which hospital really. I would say like if you don't have
You get a discount.
discount,
I know
What was
hospitals are now like the luxury bitch hospitals are now getting fucking Starbucks and McDonald's now.
yeah, Starbucks.
I got Starbucks.
We have Starbucks. We need people caffeinated so you can live for the rest of your 12-hour shift or your 10-hour shift.
Yes.
What about your second part of your question?
I would say like maybe $5 to $7 or $8. Yeah, it's pretty pricey for me, but people still go there unless you're asking because you want cheap meals. Then depends on what you get.
That's not that bad.
To-
Now,
to
now
get your
the other part of the question was, is the price higher for patients? Like, you know how they get their medical bill and it has all the meals on it? Is it higher for that same meal? Like, say you get the exact same meal down in the cafeteria. Does it cost more to the patient?
If you're like an inpatient and they charge you, I really don't know. I've personally have never been admitted to the hospital myself to realize how
You can't work on yourself?
like I don't know. We just order for people and like however much it costs, that's not my problem because I'm just ordering it for you. I don't know if it makes a difference, but people tend to say they hate hospital food because we we have multiple diets in the hospital. Like if you're there because you had a heart attack and we did a lot of things to your heart. Obviously, you're not going to be eating a cheeseburger right now. You're going to be eating some bland ass gross food.
What if I want a calzone?
Some bland ass gross food.
It's bland. They're like, I want a cheeseburger, sir. You just came out of the procedure that literally cured you from your heart attack.
Did
Please.
I ask your opinion, or did I ask for a cheeseburger?
I asked for a damn cheeseburger with
Well, then you
bacon
guys
on it.
to get cheeseburgers, not the heart attack people. No.
Put some beef jerky on there too.
I was like, oh my god. So people they look at the food and it's kind of disappointing. It's just bland. It's just really taste of your preference. Or if they're not really meeting up to your standards, if like that halal food or that like vegan food isn't up to your taste bud standards, they just buy out anyway. So is it better? Which one's better or worse? I'm like, I don't know, that's up to you. But if you're really hungry, you can eat the food we give you. That's my opinion for that.
But they got Jello right.
Wait, so I have a question.
Eat Jello, that we kind of told you so.
So I kind of have a question still on the same topic. Are the cafeteria staff on the hospital payrolls or are they contractors?
It should be under hospital, isn't it?
Because, like, for example, a school, like the school cafeteria, they're contractors. They're not actually on the school's payroll.
I think they're hospital. I think because they work at certain hours, but I'm not really sure. I never really asked them before. I'm like, hey, you work at the hospital or someone work for you? I know security. Usually security is like off. It's not part of the hospital.
No, definitely.
Yeah, it's
not.
like Allied or something like that.
Right. But like, I think the hospital because dietitians have to work with them.
Mm,
So then, if the dietitians want to change their mind, it's like, hey, this person can't eat solid food anymore. They had a stroke, so you have to give them gross ass mushy food so they can swallow it. It's absolutely disgusting.
Makes it
Actually, no
sound
one
so
wants to do that.
good.
Oh
But
no,
it
I've had
sounds so good.
it's so nasty. I'm like, does it even taste good?
Give me
No,
another bowl of that mashed up, mushy, flavorless crap.
it's so gross. It's like disgusting. So I wouldn't be surprised if they don't want to do that. Really
Mm.
wouldn't. So
All right, here
I have a question.
food.
Not food, nothing in regards to food. This is a legitimate one. Just a curiosity. Are specialists are they usually privately? They're privately owned, right? They're not under government, or they're
A Medicaid specialist, so then
okay.
they exist, but you have again limited options. Like there's maybe if you're on Medicaid, you have like 2 doctors you could go to. But if you have
Mm,
insurance, you could go to like 18. You have an
yeah,
option.
yeah.
So that it's not really government based. Mostly they like privatized ones just because they probably get paid more. I don't really know the reason of why they choose that, but
I just feel like the government. I don't think they want to pay for a lot for the specialists. That's why.
no
Because it's
one
more
does.
for because it's more for the public. They could just refer to the private one, but that's it. That's up to the people. But if anything else,
Yeah,
whatever, just commonly procedures kind of things from hospitals is what you get.
yeah. It depends on like even honestly, it depends on the company they're contracted to. Sometimes the company doesn't want to accept Medicaid, so they simply tell you we're not accepting Medicaid because my contractor won't let me take your insurance.
Yeah. That sounds right. Yeah.
So that's usually the reason. Like medical care wise, we will treat everyone the same way. Supposed to be, but
Mm,
insurance we don't have control.
yeah. Okay.
All right, so we're gonna get to the last
The hottest
question
topic of them all.
and a few bonus questions as well.
Okay.
So we'll start
And
with
it's
this.
not the last question.
It's technically it's not, but it's part of the main 13. But anywho, should and here's the hot topic and controversy. Should hospitals cater to the LGBTQ plus uh, social pronoun rules?
So what do you mean by cater to?
So let's say, for example, a transgender guy to female, um, they want to be referred to as a woman, and but the way they're being checked, they have to be referred. Does this happens in your?
We say a lot. They come in. They're like maybe like let's say 21-year-old female because you're born a female, but then when we actually see the patient, they're saying they want to be called a male. They want to be called like I don't know some random.
Uh,
I mean, as
I
long
have
as
a
you're not an
yeah.
asshole about it, I guess.
I have a question for
She
that,
should be
Trini.
forced to.
What's
Yeah,
your
Trini. So for in regards to that, in your specific line of job and description, do you have to when you read the report, do you actually have to say like their gender, for instance, be correct?
let's say I'm
When
giving
you
a report, I'm like giving like a handoff report. We
mm-hmm.
usually say like 21-year-old female wants to be called, I don't know, Howard, but the name is something else.
Mm-hmm.
They came in for this and this and this and blah blah blah. So we are kind of forced to cater to your needs and we just have to deal with it. Unless it's like
Okay.
screaming inside, like, please call them Howard, or else you'll just never hear the end of it. Just stick with it so you can move on with your life.
Yeah,
Yeah.
unfortunate for that
I was
part.
gonna say it's something that you should just kind of, if you don't want to hear the end of it, just listen to what they want and just
anything
not make
outside
a
of
scene out of it.
anything outside of your jurisdiction, then that's something that you have to cater to the patients, unfortunately.
Whenever we're talking to if they want to choose their own pronouns, we kind of just talk about the issue rather than the pronouns.
Of course, yes.
Unless, of course, there's something that's happening to them because they're taking hormone therapy stuff, and it's like, well, you're having this issue. One of the reasons could be because of hormone therapy, and it's causing this or that problem. But we just ended there. We kind of like to state more facts than more political reasons. We're not supposed to do political stuff.
No, you're supposed to help them medically, not for.
You're like, here's what you need. This is what you need to do,
and that's it.
Then maybe move on.
Yeah, pretty much that's it.
So we have to, but it is what it is.
Yeah.
What do you mean, mate?
Okay, but it's funny because like sometimes on the board, it's like we have to write in the comments. It's like you must be referred as like he or him. And I'm like, who is this person? It's like, oh yeah, be careful with that one there. They really want to emphasize, like, oh my god, be careful of your words.
Yeah,
you'll never hear the end of it. Like, oh.
Yeah, that's and like I said, it's anything that's pretty much outside of your jurisdiction.
Like, what happens when you have to, I guess I'll put it this way, inspect their genitals for medical reason, and you're explaining that to them, and they get offended by it? What do you do by
Why
then?
are they getting offended by us medically looking at them, though? You were asking for a medical exam, so.
I mean, well, at that point, they're just being unreasonable.
Yeah.
It's like let's say like a female that's transitioning to male, but they're complaining of breast pain. We're going to have another person come in as a witness to say we're not doing anything sexual to you, we're just checking you. And if they're being offended by that, I'm like, I don't know how to help you. Like literally, I don't know how to help you if you're offended by us trying to treat your problem by looking at you and examining you.
Yeah, and also you should just ask him which one do you want to be examined by, male or female now.
Yeah, some people I've seen some providers say like, oh well, we understand you want to be called male. Well, we're gonna stick with the male for now. We're gonna call you he, him, whatever. And
Just call it he man.
So why you're here? Why do we need to treat you here?
I swear.
Anyone else want to add to this?
Nope.
Yeah, no.
Good.
There's nothing else to really talk about, really.
Okay, so this question is actually a returning question from one of our older episodes of our podcast,
which I'm pretty sure I was not in.
Well, you were part of it. I don't know.
I feel like okay, but
Yeah,
I'll take my take on it now. Then
you weren't there for, and Loki likes chocolate milk, as he puts it.
This is a Rolo.
Okay, and
what does our viewer want to say or ask?
All right, here it is. The returning controversial question. Should children under the ages of 5 to 11 transition?
Oh my god.
Not that again.
I thought we already put that to bed.
Medically or socially?
Oh my god.
Shut up. There's no socially transitioning.
Yes, there is. Shut up. No, you're wrong.
No,
anyway, moving on.
Okay, let's debate that too, because that's also going to be the question after. So I might as well just, add that in already.
Oh my god.
Because I knew someone was going to ask medically or socially. So let's start with the medical.
Medically? No.
Absolutely not.
Unless there's some super extreme, rare, never will have a situation.
If there's,
now I'm glad you brought that up. I wish Arachno was here. Shall I put up a source video that was given to me by a detransitioner?
No.
Please no.
The viewers wouldn't be able to see it, right?
No, we could show it actually.
No, I would just advise against showing other videos.
Yeah, I don't want anything that's coming up later on just to deal with. The viewers just no.
I already.
Which is funny
Already-
because this question was requested for us to go back to by a few viewers.
No.
If those people have heard my position on this before, if they probably already know my position on it. No, kids from 5 to 11 should not be able to transition that early. It will fuck up their brain mentally, and later down the line also mess up their brain mentally.
This question was actually aimed towards Arachno, but unfortunately
She's not here. She's not. Yeah.
I'll take up the sword.
I'll answer that question.
Oh
Actually,
Jesus!
yeah. Well, no. I'm actually I'm not trying to like.
Now, if let's say they grow up a little bit and they still have, or no, they begin to develop gender dysphoria. I don't know. Take the right moves of, go to a therapist. Let the kid have self-discovery. If they're really adamant about it, they have to live through that lifestyle. Make sure that's 100% what they want. Because as soon as you go through that transition, it damages the biology, and retransitioning is even worse because you're damaging your body even more. So,
Okay, so how about this hypothetical scenario, right? So,
God.
let's just say you go to multiple therapists, right? And each therapist has a machine, right? And the machine scans the person's brain, and it can tell definitively 100%, no gray area, that if you don't begin to medically transition your child, they will forever attempt to kill themselves. Then what?
How can they?
Doesn't matter. It's my hypothetical. I get to set the rules.
No, I'm not entertaining that question.
I don't. Okay, I kind of missed that a little bit.
I'm not entertaining that question because
Why not?
Because in your hypothetical, apparently, if you go to multiple therapists
Yeah,
that
that's my
have
hypothetical.
a machine that can't tell.
I said it can.
Oh, that can tell.
Yeah.
And it shows throughout any gray areas.
No gray
whether-
area. 100%
No,
100%
no
definitive.
gray area. It's
100%
100% definitive.
100 yes.
What?
That's my hypothetical. Yes.
If you can, no. See, that's why I'm not going to entertain it, because right now you just want to be the villain here.
What do you mean I want to be the villain?
Yes, you do.
No, this is even about this is about people engaging in my hypothetical.
Well, I'll put my take on it.
It's a hypothetical. It's a
engage in the hypothetical.
It's a hypothetical, which means that I would have to hypothetically engage in your hypothetical.
No, you're just engaging with it.
Oh my god. Can I answer the question?
Go ahead.
I would say if it were to, just in general, if it were to save my kid's life to transition. And for that reason, I don't know if I'm going to use that reason, Ren, but if it were to save my kid, if they were transition, and it was the only way, then yes. But if there's other ways to do it, I would try to enforce it a little bit more onto those ways.
There are.
Yes, I know there are, and you try to implore more to it as best as you can, then yes. Oh well,
Yeah,
then
but
no.
yeah.
Then no. Obviously, then no. I wouldn't.
Yeah, but that wouldn't be a part of my hypothetical.
I know.
Yeah,
I know.
That's the whole point. That's my whole point. People engaging with my hypothetical.
You're being addy right now. Stop.
Let's not go there. But if for the sense of being suicidal, that's kind of very like even
Well,
if like
okay. Should I?
You're
I really want to pull up that video.
You're
'Cause-
saying you're saying this hypothetical machine that doesn't exist would be
Well,
able
yeah,
to
it's
read children's brains from 5 to 11, whether
y-
they would be able to hurt themselves or
yes.